Hello, my name is Kim Graham. On behalf of myself, Dr. Amie Steele and Professor John Wardle, I'm pleased to present an overview of our conceptual paper titled Embracing the Complexity of Primary Healthcare, System-Based Tools and Strategies for Researching the Case Management Process. Healthcare provision is often a complex and intricate process. After all, we are dealing with the human organism, which is a complex system. It is possible that only through the implementation of a complexity lens will we be able to effectively prevent and manage complex health conditions. Within science, we're seeing the emergence of complexity and systems theories, and this emergence has really escalated over the past couple of decades and is influencing fields such as the social sciences, ecology, biology, and economics, amongst others. However, the integration of complexity science into the medical and healthcare domain is much less evident. This is possibly due to the reductionist paradigm which informs and frames biomedicine. Reductionism and complexity science are not necessarily conflicting paradigms, but potentially require conscious effort to integrate. In our paper, we explored the use of various tools and strategies that may bring complexity science principles to healthcare. Potentially, these tools will support development of healthcare practices and enable clinical reasoning to be researched using a complexity science perspective. The tools and strategies we have chosen to examine are exploratory data analysis, Mindmaps, and network analysis. Exploratory data analysis promotes an exploratory mindset towards data to generate novel understandings of the issue being investigated and to lead to the development of testable hypotheses. The aim of this is to maximise opportunity to learn from the data and to create an openness to receive unanticipated information. Mindmaps are a non-linear network structuring process which can provide graphical representation of a complex system. In a mind map, identified elements are shown linked through associative relationships, encouraging movement away from linear thought towards pattern identification, potentially an effective way to engage with the complex human system. Network analysis is enabled through the development of software programs and computer data handling capability to enable computer-generated graphical representations of complex systems, such as the human organism. These can then be mathematically analysed to provide information on the network structure as a whole or on the elements and relationships within the data set. Our paper represents a preliminary foray into the value that a complexity science perspective may have in the exploration and development of clinical reasoning and healthcare practices. It is possible that healthcare that is supported by complexity-informed research and which engages with the human organism as a functioning complex system may increase efficiency in the areas of illness prevention and the management of chronic conditions. Thank you for your time. If you would like to make contact regarding our paper, please send an email via the address on screen.